Good days. We are from Group 8 and we are going to present our part on skin cancer. Skin cancer or skin neoplasm is the malignancies that can occur on the skin and occasionally may spread to the internal organs of the body. Skin cancer is normally caused by several factors spanning from genetic factors, chemical reactions on the skin, and excessive ultraviolet radiation from chronic sun exposure. Here are a few of the current technologies used in diagnosing and treating skin cancer. Dermoscopy is an examination of the skin by doctors or specialists using the skin surface microscopy, which is non-invasive, and all images and videos are evaluated by experts. Next is PCR, where it functions to amplify DNA. PCR is sensitive and specific when detecting skin cancer. It will include blood sample collection. For treatment, surgical procedure is still favored because it removes the cancer cell directly from the skin effectively. Interferon therapy is carried on after surgery to stimulate immune system to fight cancer cells. That's all from me. Now, I pass the presentation to the next speaker.
For advantages of current tech. For the dermoscopy, enhanced diagnostic accuracy allows dermatologists to examine skin lesions. Also non-invasive and painless. Dermoscopy is non-invasive. Real-time assessment and monitoring. Dermoscope enable real-time evaluation of skin lesions. For the PCR, it's high sensitivity and specificity. PCR is highly sensitive and specific molecular. Rapid and accurate results can deliver the results within hours. And versatility. PCR can adapt it to detect a wide range of pathogens. Antiviral and immunomodulatory effects that are proteins that play a vital role in the body immune response against viral infections. Also, broad antiviral activity. The interferons have activity against a wide range of viruses. Established treatment option that interferon therapy has been used for several decades. For the limitation of current tech, for the dermoscopy, training and expertise required. Accuracy intervention of dermoscopic image requires specialized training and expertise. Subjectivity and interoperable variability. Dermoscopy interpretation can be subjective. Also, the limited specificity. For the PCR, sensitivity to contaminates. PCR is highly sensitive to the contaminations. Target sequence specificity. PCR requires prior knowledge of the specific DNA or RNA sequences. Cost and equipment requirements. PCR assays typically require specialized laboratory equipment and reagents. For the interferon therapy, side effects. Interferon therapy can cause a flu-like symptoms. Also, the limited efficacy insertion conditions. Also, the cost and availability. Interferon therapy can be expensive, especially when used for extended periods.
Hi, I'm Hafik and I will explain about the new technology for diagnosis and treatment. So for diagnosis technologies, the proposed new technology is using an artificial intelligence or AI in cancer detection and diagnosis. So what can AI do to detect the skin cancer? So AI can help to improve accuracy, efficiency, and access to care of skin cancer. It also provides personalized treatment recommendation and continuously learning from the new data. The application of AI in skin cancer detection and diagnosis are used to differentiate between benign and malignant skin lesions and diagnose of inflammatory skin disease. So for the next technology which is involved in the treatments of the skin cancer is an adaptive cell transfer or ACT treatment. ACT is a cancer treatment in which involving the injecting of the lab modified immune cells, which is the T cells, from the patient's own body back to kill the cancer cell. Usually, it involves two types of therapies. The first one is TIL therapy or tumor infiltrating lymphocytes therapy. In TIL therapy, The lymphocytes are tested for chemistry recognition, and it is given substance to increase their number. So the cells will be injected back to patients and to increase their chance to kill the cancer cells. Next is the CAR T cell therapy. In CAR T cell therapy, the T cells are modified to produce a protein called chimeric antigen receptor or CAR. CARs allow T cells to attach to the surface of the cancer cells. It will improve their ability to attack and kill the cancer cell.
Hi, my name is Simon, and now I'll be talking about how the new tech addresses the limitations of the current tech. So first of all is AI in skin cancer detection and diagnosis. So first of all, it will get increasingly better at detecting and diagnosing. This is because it undergoes machine learning in which is fed data sets for it to learn and trial and error to get the correct response and learn from it until it becomes increasingly perfect, which will become better than humans. Next is the use of AI to identify and monitor the evolution of skin cancer may result in few unnecessary biopsies, incorrect diagnosis, and false negatives or positives, which is a huge aid towards less experienced dermatologists and where they can learn from, which also reduces time wastage. Last but not least, it is accessible, economical, and easy to use with smartphone applications that can detect skin cancer, which assists in faster diagnosis when the results are sent to an expert, which also in turn reduces the cost. Next, I'll be talking about how we can address the limitations of the current tech with the new tech, which is active cell transfer therapy. So first of all, it still has side effects, which includes coughing, dizziness, and decreased appetites, and others. But the efficacy is increased as the therapy is tailored to each patient. As you know, personalized treatment is always better than general treatment. And last but not least, the cost depends on several factors such as the facility where you are being treated at, the complexity of the procedure, and the specific protocol used. So that's all from me. Thank you.
Hi and Assalamualaikum. I am Hisham and will be presenting on the impact of new ideas on society, environment and sustainability of artificial intelligence in skin cancer detection and diagnosis. Impacts that AI has on society include faster diagnosis. The iPod system can quickly analyze and diagnose skin images, reducing the time it takes for patients to receive a diagnosis. AI can also help predict the likelihood of skin cancer recurrence. Next, the environmental impact is AI uses significantly less resources and materials compared to dermoscopy and PCR tests. This is because AI only requires appropriate software, while dermoscopy and PCR require a lot of materials to produce the apparatus used. And then lastly is the impact on sustainability. AI has basically an infinite lifespan than dermoscopy and PCR. The reason behind this is that AI, unlike dermoscopy and PCR, is impervious to destruction and continues to improve over time through software updates. Dermoscopy and PCR rely on physical apparatus that may deteriorate over time and require periodic replacement with new equipment. Now we will discuss the impact of adoptive cells transfer (ACT) in skin cancer treatment. Impacts that it has on patient or public safety include side effects of ACT that depend on the type of cells being used and the type of cancers being treated. There is no direct environmental impact as ACT does not involve any hazardous waste, toxic chemicals, and radioactive materials that can potentially harm the environment. However, it might have indirect environmental impacts, such as production of the growth factors and cytokines used in the expansion of immune cells, may generate waste and emissions that contribute to pollution. Furthermore, the transportation of these materials could result in the emission of greenhouse gases and other pollutants. An example of a sustainability impact is the expensive cost of CAR T cells treatment, which consequently leads to limited accessibility. The primary expenditure associated with CAR T cells treatment lies in the cost of acquiring the medications, depending on the specific drugs and indication. Other auxiliary factors also exert a considerable influence on healthcare expenses. And that's all from us, Group 8. Thank you for your valuable attention.